Good morning, everyone. Good morning, mates, especially to our instructor, Miss Nuarez Peña. Good morning, ma'am. So, we are the Group 7, and I am Cadet James Albert Galiana, who will be, together with my group mates, will be discussing about what is schizophrenia. Schizophrenia is a group of disorders characterized by loss of contact with reality, marked disturbances of thought and perception, and bizarre behavior. At some phase, delusions or hallucinations almost always occur. So, in short, schizophrenia, when a person experience mental disability, they will be lost contact with reality. So, meaning to say, wala na sila, layo na sila sa tinuod nga kalibutan ba? Di ba? Disturbances of thought and perceptions. Kabantay mo nga kung ang tao nga dili maka-focus or stress kay murag gaka-disturb ang imuhang ang concentration, dili ka ka-concentrate sa mga butang ug murag iritado ka pirmi, di ba? And some phase, delusions or hallucinations almost always occur. So, di ba? Naa sila yung mga kaugalingon nga panghuna-huna. Na sila kaugalingon nga kalibutan kumbaga. So one of the example of this is kana bitong ato ang makita sa dalan nga mga gasuroy-suroy na bitaw. So although dili gina sila ingon nga buang gyud. Ako dili gyud ko makaingon nga buang sila, but na sila ning schizophrenia, di ba? Di sila makasabot gyapon sila sa tuwa, pero at some point mas taas ang percentage nga na sila mga delusions or hallucinations nga kaka-experience. Emil Kraepelin. Emil Kraepelin is the first who identified the illness in 1896 when he distinguished it from the mood disorders. He called it dementia praecox. So dementia praecox, which means a premature deterioration of the brain. Emil's thoughts were later disputed by many psychiatrists. So what is dementia praecox? Like schizophrenia, it is a severe mental health disorder. This condition can lead to a warped interpretation of reality. And also it can significantly impact the person living with it, as well as those closest to them. Also, one of the pioneers of Emil Kraepelin schizophrenia was Eugene Bleuler, an eminent Swiss psychiatrist who in 1911 gave the term schizophrenia. He developed the word by combining two Greek words, the chizin and the phren. The chizin meaning to split and phren meaning mind. This emphasized the splitting apart of the patient's affectively and cognitive functioning, which are heavily affected by the disease. The categories of the schizophrenic hallucinations. By the way, what is hallucination? Huh? Hallucination is a false perception of objects or events involving your senses. The sight, the sound, the smell, and the touch. So hallucination, from the word false perception. Yeah. Ang imong ginahuna is known as, or more likely, not connected or dili siya related sa tinuod nga scenario sa kalibutan. Una siya ang meaning sa hallucination. False perception are events involving your senses. Let us jump to the main topic, which is the categories of schizophrenic hallucinations. The first one is the tactile, or the touch. People with schizophrenia often have the sensation that there are things like bugs or insects crawling across their skin. Okay. In short, kada mga tao nga kaka-experience of schizophrenic hallucinations, feeling nila nga naiga kamang-kamang sa ilahang panglawas. Like bugs or insect, muna ka nang mga pesticides bitaw nga nasa tangkuhan. Mo na siya maka-cause pod ang irritable sa ilahang panglawas, which is na sila mga movement nga unnecessary. Nga nakakita nato normal people sa ila. The next one is the visual or the sight. This kind of hallucinations causes the persons to see things that are not really there. Yeah, from the word visual. Na mga butang nga gakakita nato. I mean gakakita nila nga dili gakakita sa ato normal nga tao. And this thing nga gakakita nila which is not in reality, not in the real scenario or situation. Di ba? Layo ra sa tinuod nga panghitabo. Layo ra sa ato ang gakakita sa tinuod nga kalibutan. Kasi sila naa na sila kaugalingon mga butang nga gakakita which is dili nato makita mga normal nga tao. And the third is the auditory, which is the hearing. This is the most common type of hallucination. People with auditory hallucinations hear voices and sounds that others cannot hear. Di ba? So this person who experience the schizophrenic hallucinations, they hear things unusually nga dili na to gakadunggan, di ba? That is why nga dili na to na sila may istorya og tarong kay naa sila gakadunggan nga lain tingog. Even though nga normal lang mong istorya sa ilaha or naa kay istorya sa ilaha nga um, dili sa pang-insulto, but imo silang gistoryahan because of this auditory kind of hallucination nga schizophrenic hallucination. Abi nila og istoryahan nimo sila kay istoryahan nimo sila og dautan kay mura sila og bungol. Dili nila masabtan ang imong gistorya nga tarong tungod kay nanay gababag sa ilang dili siya sa dalunggan ha, but sa ilang utok. Their hearing senses is not in a good condition. So, di ba? Mura siya ganang their hearing senses was disabled. Na siya disability. So, the fourth one is the olfactory, which is the smell. The person experiencing an olfactory hallucination smells things, usually foul-smelling things that others do not smell. Diba? Like kita, tao, namang gintay sakto nga panghuna-huna. I mean, sakto nga sense of smell. Di ba? Ato ang ma-identify diretso if musimuta sa durian. Baho ang durian pero lami ang durian, di ba? Muna siya ang mga normal smelling senses sa tao. Nga dili nga wala siya sa mga schizophrenic person, di ba? Kita nakasimuta ang atong environment is humot pero para sa ila dili. Kay ang ilahang hallucination is maka-affect sa ilang senses. The five senses nga ilahang nga nasa ilang kaugalingon can affect, diba? So muna siya na yung mga butang nga masimutan na to tarong pero para sa ila is bad smell bisag sakto god. And the fifth one is command or the hearing, same as the auditory hearing, but different siya because command hearing, when a voice commands the person do something he or she would not ordinarily do. Na mga butang nga kabuhat nila nga para sa to normal people is nganong gibuhat na nila nga dili man na normal para sa to. Pero the reason why they do those things, it is because there are person or which is the hallucinations commands them to do that thing, diba? Which we normal person don't think that ang ilang gibuhat is normal. Para sa tuwa is dili normal, but sa ila is normal. Kaya nagakuman sa ila. Like for example, kung may ingon lugar ang sa ila, nagakuman sa ila nga, uy, kanang kuha na nga pagkaon, kay gigutom ka. Diba? And kana siya nga pagkaon is naitag iya. Pero, kaya nagkuman sa imo is tungod lagi kay ang command is kanang dapat buhaton nimo. So bisag na siya tagiya, wala kay paki. Kung na ba kay makuan nga tao. Kung naa ka ani schizophrenic hallucination which is the command hearing, wala na kay paki kung kwaon kung say bation sa lain tao nga kwaon nimo ng pagkaon because naay nagkuman sa imo which is not normal para sa toa. Because when we connect this hearing sa atawang senses of affection, wala na sila'y feeling kung naba sila ay napasakitan sa ilang pagbuhat ana nga butang. They always think that the command they hear is always right and always beneficial to them. That is the fifth category of the schizophrenic hallucinations. The next topic is the characteristics of schizophrenia. The first one is the disturbance of thought and attention, which divided into two categories. The, f- the prosecutory delusion. The second one is the delusion of reference. But we have to first know what is the disturbance of thought and attention in schizophrenia. Now, people suffering schizophrenia often cannot think logically, and as the result of this, they cannot write a story because every word that they write down might make sense but are meaningless in relation to each other. Diba? People who suffer schizophrenia cannot think logically. Dili sila makahuna-huna logically like we humans, normal person, normal people nga nasa saktong panghuna-huna nga maka-analyze yung mga butang. So, na yung mga butang nga dili nila masabtan, nagpataka lang sila og una-una. And as the result, they cannot write a story because if they say something or make a scenario or na situation nga naitabo sa ila, they might said or they might create a story that cannot make sense. Dili gid siya katuhan. 50-50 siya nga matuhan, di ba? Kay nabiya sila'y disability which is dili matuhan basta-basta sa tao. And the principal disturbance in schizophrenic thought process is multiple delusions. Diba? And it is divided into subcategories. Muna ni siya. The prosecutory delusion. The schizophrenic believes that he or she is being talked about, spied upon, or his or her death being planned. So ang mga tao nga na schizophrenia is they think nga permi sila ga istoryahan sa tao. Even though wala good, di ba? Kung natay makita nga na yung mga nga condition nga tao sa dalan, ato lang silang tanawon kay murag hunahuna nila. I mean, kung ato silang gitanaw tapos na rin kay istorya, hunahuna nila gistoryahan na din ato sila. But that is not true. But and they think and they imagine themselves nga sila ang gistoryahan. Muna siya ang naa sa prosecutory delusions. They think that they were spied upon. Naipirmi ka sunod-sunod sa ila, but wala good. Diba? Ang kanang tao nga nagsunod sa ila is pirmi sila, irritable sila, pirmi nila lingion kay abi nila gasunod-sunodon sila. Pero dili. And their death is being planned. Diba? Nauna nila nga ang ilang kamatayon. Kay sakit pa malandungon ba nga ang may mga condition nga is kabalo sila nga murag or ginahuna nila nga ang ilang kamatayon kay duol na. Kabalo sila kung kansa sila mawala sa kalibutan, di ba? And the next one is the delusion of reference. The schizophrenic gives personal importance to completely unrelated incidents, objects, or people. Like for example, kana mga unusual person nga na schizophrenic, mura sila paranoid ba nga gawna-hunaon nila nga nay mahitabo nga dili maayo. Di ba? Nay mahitabo nga calamity or for example calamity or kana siya nga tao is pwede nila iingon diretso kay nega storya silang una-una, uy ikaw paras ka, bantay ka kay madiskusya ka ugma, di ba? So naa na siya sa delusion of reference when a person experiencing schizophrenia. So mo na siya. The next one is the disturbance of perception. During acute schizophrenic episodes, people say that the world appears differently to them. Their bodies appear longer, colors seem more intense, and they cannot recognize themselves in a mirror. In this part, kana bitong people who experience schizophrenia, feeling nila nga ang ilang body or ang ilahang pamarog kay dili na magdugay kaysa sa lain tao. And ang ilahang pamanit or ang ilang standard sa ilahang pamanit is different to others, di ba? And kung batanaw nimo sila sa amin, dili na nila gaka-recognize ang ilang kaugalingon because what they saw in the past, what they unsa ang ilang gihunahuna nga posture nila from the past. Kung ipatanaw nimo sila sa amin is dili na nila gaka-recognize silang kagalingon because of the change of posture nga naitabo sa ila ano bitaw nga kabag-uhan sa ilang kaugalingon physically. That is the disturbance of the perception. And the third one is the disturbances of affect. Schizophrenic persons fail to show normal emotions. This symptom is easiest described as an excessive lack of correlation between what an individual is saying and what emotion they are experiencing, di ba? Kasagara sa mga tao nga na schizophrenia is kaka-disturb ang ilang affection. Dili nila mapakita ilang tinuod nga ang emotion. Dili sila makapakita sa tao og mga normal nga emotions, like bisag nagbaklay lang sa dalan, like for example na nagbaklay sa dalan tapos nikalit lang og katawa. That is one of the example of the disturbances of affect, which is the relation of schizophrenia, who experience schizophrenia. A person who experience schizophrenia kanang gabaklay sa dalan nga nagkatawa rag kalit, which is kita normal nga tao makita nato nga wala may katawanan pero nganong gakatawa sila, di ba? Nganong nay nag-smile, di ba? And the correlation between what an individual is saying and what emotion they are experiencing, dili nato makita, dili nato ma-feel kung say na feel nila busa nga dili normal atong pagtanaw sa ilaha. That is one of the aspects na we can identify a person with schizophrenia, by the disturbances of affect. The fourth one is the withdrawal from reality. During schizophrenic episodes, the individual becomes absorbed in his inner thoughts and fantasies. The self-absorption may be so intense that the individual may not know the month or day or place where he is staying. Aning stage, the withdrawal from reality. Aning stage, ang tao nga na schizophrenia, di ba? Tungod kay absorb kay sila, tanan butang is they thought, they use their hallucinations and their thoughts and fantasies, di ba? More on kalipay ra sila, self-absorption. Kaka-experience silang mga intense nga butang, resulting wala na sila kabalo ug asa sila napadulong. Wala na sila kabalo kung unsa ilang gipang buhat, unsa ilang mga dabuhat, unsay nahitabo sa ila o unsa na nga mga lugar ang ilang natuan. Because when they do things which is kanang magbaklay-baklay sila and they experience the withdrawal from reality, ano mga hallucinations nga ga-create sa ilang hunahuna. After that intense feelings or the fantasies nga nahitabo sa ila, dili na nila ma-remember pa kung asa sila nagsugod o asa na sila karon. Muna siya ang nasa withdrawal from reality. In the last part, the fifth one is the delusions and hallucinations. Muna siya. In most cases, it is accompanied by delusions. Delusions are inflexible, misleading beliefs. They appear as a result of exaggerations or distortions of reasoning, as well as false interpretations of things and events. The most common are beliefs that other persons are trying to control his thoughts. He may become suspicious of friends or paranoid, di ba? And this is the reason why Robert Kennedy was assassinated. So, short story about the death of Robert F. Kennedy. On June 5, 1968, RFK or Robert F. Kennedy was shot by Sirhan Sirhan at the Ambassador Hotel in Los Angeles, California, and pronounced dead at the following day. So, at that year, Robert Kennedy was shot by Sirhan Sirhan. So, who is Sirhan Sirhan? Sirhan Sirhan is a Palestinian refugee at that day. And according to Sirhan Sirhan, Robert Kennedy was his hero, his winner, champion that day. But because of the statement of Robert Kennedy where he said that he will deploy more jets, more grenades on Israel, that makes Sirhan Sirhan think a lot. That made the delusions or hallucinations or the misleading interpretation, the misinterpretation of the words of Kennedy, that makes Sirhan Sirhan, makes Sirhan Sirhan analyze things negatively. Diba? So si Sirhan kay abi niya nga ang paghatag or pagdeploy ni Kennedy og mga jets sa Israel is makakreate lang siya og distractions or killings of human beings. That's why nga that is one of the reason why he assassinate Robert Kennedy that year. So ang uban pa nga storyana is pwede ra pud nato nga siya i-search, pero mag-focus lang ta sa ato ang study about the schizophrenia or the delusions or also hallucinations. So that's all.
Good day everyone. By the way, I am Kadit Manaligod and I've been tasked to discuss about the kinds of schizophrenia. So let's start about number 1. Paranoid schizophrenia. If a person has paranoid schizophrenia, he or she A. is very suspicious of others. Like, kanang grabe bitaw siya makatag og mga motibo or duda sa ubang tao. B. has a great scheme of persecution at the root of the behavior. So, ay siya kay naay isa ka great nga pamaagi para pag-usig sa ugat sa kinaiya sa isa ka tao. C. hallucinate and delusions, which are also symptoms of this type of schizophrenia. Like, kanang delusion and hallucinate, siya is like makakita mga butang or makadungog mga butang nga dili nato makita or which nara sa iyang mind. D. displays the psychotic symptoms. Makita gyud ang sa atong mga mata nga kana nga tao kay nagid na siya mental disorder. Number 2, residual schizophrenia. Residual schizophrenia is usually A. expressed through persons being not motivated or interested in every life. Dili na siya interesado sa kinabuhi or dili na siya interesado mabuhi. B. advice when an individual has been through at least one episode of schizophrenia but the recover. Kani sila na mga tao kibali na reduce ang ilang mga symptoms sa schizophrenia na ug pwede siya makabalik sa ilang mga sigiya na normal na kinabuhi. Number 3, disorganized schizophrenia or hebephrenic schizophrenia. This schizophrenia is characterized by A. person is incoherent verbally and to those her or his feelings. B. expressing emotions that are not appropriate to the situations. Like for example, kibali na mo sa situation nga naa mo sa pagsubo, while kaning mga tao nga naay kinds of schizophrenia is kalit na siya mo katawa bisang walay katawanan. Number 4, catatonic schizophrenia. A person diagnosed with catatonic schizophrenia is extremely withdrawn, negative, isolated, and has been obvious psychomotor disturbances. Kani siya mga tao like negatibo na niya pagununa at mas gusto na lang niya nga mag-inusara or isolated. B. The subject may be almost immobile and exhibit agitated, purposeless movement. Like makabot siya mga butang na wala niyang gituyo nga gibuhat niya. Purposeless movement. C. Symptoms can include catatonic stupor and waxy flexibility. How schizophrenia develops? Schizophrenia develops through any of the following causes. Number 1, genetic cause. A cause of schizophrenia usually lies in a person having immediate relatives with a history of schizophrenia or other psychiatric diseases. Schizoaffective disorder, bipolar disorder, and depression. Some researchers consider schizophrenia to be a highly heritable, estimates are as high as 70%. Kanidang genetic cause, mga mates, is immediate relatives with a history. Atong mga relatives ka na yung mga history sa mental disorder, usually daw kuno makuha gid ato na sa ilang genetics. Example, nakikaliwat nga naay mental disorder. Ang possible po dahil na ang iyang mga igsoon is naadya po'y mental disorder pa yan niya. Number 2, environmental or social cause. This is considerable evidence indicating that stress may trigger episodes of schizophrenia psychosis. For example, emotionally turbulent families and stressful life events have shown to be some of the risk factors for the relapses or triggers of schizophrenia episodes. A social drift hypothesis suggests that people affected by schizophrenia may be less able to hold demanding or high-paying jobs. As a result, low income steady and problems increases stress levels and leave such people susceptible to lapsing into a schizophrenia episode. Usa po daw sa makakos sa schizophrenia is ang environment o social cause like ikaw nga tao ka stress so naging possibility nga makakuha ka ana nga sakit. Number 3, prenatal cause or casual. Casual factors are thought to initially come together in early neurodevelopment to increase the risk of later developing schizophrenia. Example, prenatal exposure to infections. One curious finding is that people diagnosed with schizophrenia are more likely to be born in winter or spring, at least in the northern hemisphere. So katulad ako nung makakos sa schizophrenia is sa prenatal stage pa lang, like example, katulad mga babies nga gianak sa winter or spring season is sila daw nang possible nga prone to schizophrenia. Number 4, substance abuse cause. In a recent study of people with schizophrenia and a substance abuse disorder, over a 10-year period, substantial proportions were above cutoff selected by dual diagnosis clients as indicators of recovery. For example, is illegal drugs, tobacco, and alcohol. Pasabot ani guys, katudong mga taong lulong sa illegal drugs, tobacco, or sige bisyo, and alcohol, gainom og permig mga alcoholic drinks, sila ang prone nga makakuha og schizophrenia nga sakit. Mauna na akong discussion mates and we will proceed to another reporter.
Reactive or acute schizophrenia. Reactive schizophrenia is usually sudden and seen to be a reaction to some life crisis. Reactive schizophrenia is a more treatable form of the illness than process or chronic schizophrenia. So, reactive schizophrenia is typically sudden and seen to be a reaction to a life crisis because it is triggered by significant stressor or traumatic events. When individuals experience intense stress or trauma, it can disrupt their brain chemistry and trigger psychotic symptoms associated with schizophrenia. Next is process schizophrenia or chronic schizophrenia. Process schizophrenia is also referred to as comorbid schizophrenia. This type is characterized by lengthy periods of its development with a gradual deterioration and exclusively negative symptoms. It doesn't seem to be related to my major life change or negative event. Usually, this type of schizophrenia is associated with learners who are rejected by society, learn not to develop social skills, and don't excel out of high school. So, chronic schizophrenia, also known as comorbid schizophrenia, develops slowly over time with primarily negative symptoms. It's not typically triggered by major life change or negative events. People with this subtype often struggle to form social connections, may isolate themselves, and find it difficult to develop social skills. They tend to perform poorly academically, often not advancing beyond high school. This type of schizophrenia is often seen in individuals who are social learners or rejected by the society. And next is schizophrenia, and criminality. The association between schizophrenia and committing violent acts of different forms of crime is evident in literature encompassing interpersonal attack and murder. Compared to their healthy counterparts in the general population, individuals diagnosed with schizophrenia are 46 times more likely to commit a violent crime. In Western countries, 6% of the homicide perpetrators in the population were labeled schizophrenia. Existing research also indicates that the prevalence of crime in patients with schizophrenia is significantly associated with men 6 being single, refusing to accept treatment, substance abuse, and duration of illness. So, schizophrenia and criminality. Schizophrenia are much more likely to do violent or criminal things like attacking or killing someone. This likelihood is 46 times higher than in the general population. Factors like being male single, refusing treatment, using drugs, and how long they've had the illness make this risk even higher. People with schizophrenia are also more often involved in serious violent crimes, especially when it comes to killing their own mothers. A study found that men with schizophrenia are 2 to 6 times more likely to be convicted of crimes compared to healthy men, and they commit various types of crimes more frequently. That's all.
Good day everyone, I'm Cadet Porzuelo and I'm going to report sexual disorder or sexual dysfunction. So, sexual dysfunction are disorders related to a particular phase of the sexual response cycle. Sexual disorder include problems of sexual identity, sexual performance, and sexual aims. So, sexual dysfunction is a common problem among both men and women. It can be caused by physical problems and medical conditions such as heart disease and hormone imbalances, or by a psychological problem like anxiety, depressions, and the effect of the past trauma. So next is, what is the symptoms of sexual dysfunction? In men, inability to achieve or maintain an erection suitable for intercourse, erectile dysfunction. B. Absence or delayed ejaculations despite adequate sexual stimulation, retarded ejaculation. Inability to control and timing of ejaculations. This is early or premature ejaculation. In women, inability to achieve orgasm. B. Inadequate vaginal lubrication before and during intercourse. C. Inability to relax the vaginal muscles enough to allow intercourse. And the next is symptoms of sexual dysfunctions in men and women. First is lack of interest in desire for sex. So, kanang butang bitaw nga, sige na lang sila og sex, then mawadaan sila gana. And then for B, inability to become aroused. So, kanang feeling bitaw nimo nga turned on naka sexually. Kanang imong lawas bitaw nga maka-experience na ka na og kabag-uhan. And C, pain with intercourse. Like sa sige nimo og sa sige nimo og kanang mag ana-ana mo like na din siya kuan na magsakit ang imuhang private part. And the next is human sexual response cycle. The sexual response cycle refers to the sequence of physical and emotional changes that occurs as a person becomes sexually aroused and participates in sexual stimulating activities, including intercourse, and masturbation. The sexual response cycle has four phases. Desire, which means libido, arousal, excitement, orgasm, and resolution. Both man and woman experience this phase, although timing usually is different. The term was coined by William H. Masters and Virginia E. Johnson. And this is the human sexual response cycle. So first is excitement phase. It is also known as the arousal phase or initial excitement phase. It is also first stage of human sexual and response cycle. It occurs as the result of any erection, physical or mental stimulation, such as kissing, beating, and viewing erotic images, and that lead to sexual arousal. It is characterized by an erections in males and swelling of the clitoris of vaginal lubrications in female. So, kani siya nga stage is kanang palamian pa ba? So, magsugod pa siya. Mag-erect ang organs sa both parts. Then, second is plateau phase. It is the period of sexual excitement prior to orgasm. The plateau phase is the second phase of the sexual cycle after the excitement phase, with the following manifestations such as further increases in circulations and heart rate occur in both sexes. Sexual pleasure increase with increased stimulation, muscle tension increase further. For those who never achieve orgasm, this is the peak of sexual excitement. Both man and woman may also begin to vocalize involuntarily at this stage. Prolonged time in the plateau phase without progression to the orgasmic phase may not result in frustration if continue for too long. So this phase, second phase, which is plateau phase, amo ni siya dari na mahitabo ang paggahi sa mga muscles and mag-increase imuhang blood pressure, kanang maganado bitaw imong feeling inana. And number 3, orgasmic phase. Orgasm is the conclusion of the plateau phase of the sexual response cycle and is experienced by both males and females. It is accompanied by quick cycles of muscles contraction in the lower pelvic muscles, which surround both the anus and the primary sexual organs. Women also experience uterine and vaginal contraction. Orgasms are often associated with other involuntary actions, including vocalizations and muscular spasms and other areas of the body. Ang number 3 is wala ra siya naglayo sa number 2, which is continuation lang siya sa feeling sa nag-ana-ana. And then number 4 is resolution phase, refractory period. The resolution phase occurs after orgasms and allows the muscles to relax, blood pressure to drop, and the body to slow down from its excited state. Men and women may or may not experience a refractory period, and further stimulation may cause a return to the plateau stage. This allows the possibility to multiple orgasms in both sexes. However, typically men enter this refractory period and same may find continued stimulation to be painful after the orgasmic phase. Women may not have similar refractory period and may be able to repeat the cycle almost immediately. So, kani ikaupat, ang refractory period, kani siya nga stage or phase is makafeel na silag satisfactions sa ilang kaugalingon. Kay gahinay-hinay na og balik ang level of functioning into normal. Any swollen or erect body parts mubalik na sila sa previous nga size or position sa ilang mga private part. And that's all. Thank you. For continuation, Cadet Pacolba will be the next reporter.
Good day everyone, I am Cadet Joshua Pacolba and I will tackle the continuation of sexual dysfunction. Sexual dysfunction is a represent or recurrent problem that causes marked distress and interpersonal difficulty and that may involve any or some combinations of the following: sexual arousal or the pleasure associated with sex or orgasm, and it is the disturbance of any phase of the human sexual response cycle. So number one, it is a hypoactive sexual desire disorder. It is marked by lack or no sexual drive or interest in sexual activity. It is characterized by a represent upsetting loss of sexual desire. So, kuha na siya. Kanang about yaman sa sex nga kanang bitawng iyang partner pananglitan mo nang mangagat og makig-sex sa iyang asawa. So, kuan kanang murag wala bitaw siya gana. So dili siya mo response og kanang kuan iyang bana or asawa kay kuan siguro ang cause sad ana anang kapoy stress. So munang time nga wala sila gana makig intercourse. So number 2, sexual aversion disorder. It is characterized by a desire to avoid genital contact with a sexual partner. It refers to the persistent feelings of fear, anxiety, and disgust about engaging in sex. So, muna sila nga nang ga-avoid sila sa like avoiding touching or communication that may lead to intercourse or makig-sex. So maglikay sila para kay lagi sila lang gana, wala sila sa mood para makig-sex. So dysfunctions of sexual arousal during the arousal late phase. Male erectile disorder. It refers to the inability to maintain or achieve an erection, previously called as impotence. Kaning being able to get erection before sexual intercourse. So kanang bitawng anang erections means kanang pagpanggay sa part sa lalaki or private parts. Sa kanang bitawng sa before pa sila mag intercourse, nanay erection nga ma-feel sa laki. So anang manggahi na yang pero pag abot din sa mag intercourse na sila, dili siya dili niya ma-maintain. So mukalit lag, mawala ang gana or anang murag mahuman na silbi ang sa lalaki. So female sexual arousal number 2 is it is refers to responsiveness to erotic stimulations both physically and emotionally, previous called as frigidity. So kani sa female kana bitong anang nanay ilang wet. So kanang the vaginal lips become wet or nanay clear fluid sa ilang mugawa silang ning private parts or sa vagina. So nana sa ganang nana sila silang gana. So may laan sa nimo ang babae ug nana sa gana. So man siya, the vaginal lips become wet with clear fluid or your blood pressure kanang mainit bitaw ang lawas anang para sa babae manginit ilang lawas then pag init ana manggahi po ilang nipples became a hardened dysfunctions of orgasm during the orgasmic phase. One, premature ejaculation. Premature ejaculation, it is the unsatisfactory brief period between the beginning or sexual stimulations and the occurrence of ejaculations. So manay siya sa kuan panalitan not being to delay ejaculations for more than 3 minutes after penetrations. So kana bitawng murag dili siya kaka-satisfied or dili mapura mga human sa intercourse mga after 3 minutes murag na sad siyang gana gusto na sad siya makig another take na sad so murag dili ma-satisfied siya sa male orgasmic or disorder it refers to the inability to ejaculation during sexual intercourse so kanang bitong kani siya wala anang murag inability man so kanang mawalan siya gana bitaw murag luyahan na siya pag human nila og intercourse so kaning sa premature ejaculation kung kanang gana siya kanang bisag bago pa nauman gusto na sad siya makig another take sa dili sa number 2 kuha na siya murag ma-satisfied na siya dili na siya ganahan so sa female orgasmic disorder it refers to the difficulty in achieving orgasm either manually or during sexual intercourse so kani siya mo kanang siya when woman cannot reach orgasm or when sex is not enjoyable it become a core instead of satisfying so kaning sa ana bitawng dili nila ma-reach ang orgasm samot na og ilang partner panalitan ang lalaki dali ra mahuman na dili pa nila ma-reach ang ilang orgasm tong ilang pangita nga kuan anang katong excitement nga part bitaw inana anang samot na og dili sila ma-enjoy sa pag ilang sex anang dili kayo master mo dala yang bana panalitan ana dili sila ma-satisfied muna dili kay nila ma-reach dito ang ilang orgasm next sexual pain disorder vaginismus it is the involuntary muscle spasm at entrance to the vagina that prevents penetrations and sexual intercourse so kanisa pain during vaginal penetrations of during sex a partner is unable to insert anything into the vaginal they may describe sensations like hitting a wall at the vaginal opening so kanisa kana bitong ma-feel sa sa babae murag masakitan sila kay kuan bisag unsaon sa lalaki kanang pag insert sa ilang private part dili siya ma-insert kay labi na sa sa first timer pambae so gamay pa yang private part so muna lisod so pag ma-feel nila nga sakit masakitan sila so number 2 is this perionia it refers to the painful coitus that may have either an organic or psychological basis kuan lang kanang panalitan human nila og intercourse for example nay ma-feel sa babae nga sakit sa ilang private part or dito sa ilalim or dapit sa pelvic so mura sila narag nay katusok-tusok or kanang kainit na dili na masabot ang kasakit and the last is hypersexuality the nymphomania or furor uterinus, a female psychological disorder characterized by an overactive libido and ovations with sex. Etymology of the word is name. So kanay siya, muna siya nga kanabitang very active gid sila sa sex. Samot na kanang panalitan kung sa babae, kanang sayo sila mahilabtan, marag pangitaon na sila ang ilang ginhawa pangitaon so munang murag ma-addict bitaw sila nga gusto lang sa makig sex permi samot nagdaghan na nga kuan anang laki baka o ilang matrayan og sex kanang ma-experience so ano yung satyriasis. In males, the disorder is called satyriasis, and the etymology is satyr. So, it is a man of suffering from the conditions in sometimes called satyromaniac. So, in this is the man have sexual intercourse with as many woman. So, sa lalaki, kanami taong dagan na po iyang ma-experience ng mga babae nga ilang maki-intercourse, panalitan. So, sa sige nila kuan, murag pangitan gyapon sa ilang ginawa. So, nang munang uban nga mahimo ng manyak, makakita lang gamay sa mga mga sexy nga part sa bae, marag ilang ginawa, na kayo. Marag ganado. Any questions or clarifications to our topic? And please comment down below.
Tell me what it takes to get you feeling alive. Tell me how to show you it's a beautiful life. I'll do anything to pull you into the light, 'cause everything will change when you open your eyes. Yeah.